Crowns are used for a variety of reasons. You could have a very large cavity and the filling would be too big, too large, and so the tooth could break easily and the tooth could not support a large filling. So if that's the case, you have to put a crown on, and the crowns we use are made out of something called zirconia, which is a very, very strong porcelain. That zirconia covers the outside of the tooth and is sealed at what's called the crown margin. These help keep the tooth from breaking and provide the patient the ability to chew comfortably without worrying about a tooth breaking. On top of having a large cavity and having to do a crown for that reason, we oftentimes do a crown because a tooth breaks and you cannot use that tooth. It does not function well without having something around it. Another application for crowns is if a tooth cracks. It doesn't necessarily mean that the tooth is broken, but you can have a crack in the tooth where it's almost two halves of the tooth working against each other. So when you bite, you get that pain. What a crown does is it surrounds the tooth circumferentially and gets those two halves of teeth together and puts them back together so that you can chew comfortably. As far as bridges go, bridges are something that are used to replace a missing tooth. And there are certain circumstances where they're great restorations. If you were to have a tooth, a missing tooth, and on either side of that missing space there were already teeth that were candidates for crowns or already had crowns, that would be a great spot to do, a great location to do a bridge there. There are also, in place of a bridge, you can do implants, and that's where Taylor is his expertise. He places all of the implants in our office. But implants are wonderful because they are independent of the teeth on either side. You can restore a missing space, and the success of that restoration does not depend on the success of the other teeth.